More confusing than listening to guidance on how to handle COVID. Yet one thing is clear. The more time goes on, the more the initial guidance fades. To that point, today the CDC announced what they are calling a reset that will aim to respond faster and better to future threats. That said, as well as preparing for the fall, back to school in some cases, we thought it would be helpful to get some straight talk about the continuing COVID confusion from Mark Chenoweth, who is president of the new Civil Liberties Alliance and former chief of staff to Mike Pompeo when he served in Congress. So the CDC updated its guidance on unvaccinated people, saying that natural immunity is every bit as effective, if not more so, than all these vaccinations and boosters. Am I reading that correctly?
That is what they have finally admitted after over a year of saying otherwise.
Right.
And not just saying otherwise, but actively trying to undermine anyone who is trying to get that factual message out.
Well, the most benign interpretation of this late decision on their part is that it's a day late and a dollar short, actually maybe a couple years late and several $billion short, because a lot of people have really suffered real harm as a result of this CDC decision. The previous
Many
guidance,
people have,
not the change on August 11th, but the previous guidance, rather.
That's right. The previous guidance led many folks to lose their jobs, for example. It caused a number of people to be kicked out of school or not to be allowed to enroll in the school of their choice, the college and university they wanted to go to. It's had devastating consequences for tens of thousands of people at least.
You know, we've done lots of segments on this show which indicate in a broad sense how many of governmental institutions in our country are losing trust. The American people simply don't trust our institutions anymore. I can't think of a stronger case than what the CDC is doing here, because there are any number of studies which have been out there, legitimate, peer-reviewed studies, which indicate that the CDC should have made this decision a long time ago.
That's right. At least a year ago, they would have been able to make this decision. And really, I think from the get-go, we have known that this is a virus. Whether you're talking about measles or mumps or chickenpox, we've known about natural immunity in the context of other diseases for decades. And the CDC has had the ability from the beginning to test for antibodies. In fact, that's how they tested the efficacy of the vaccines, was to check it against the antibody levels that people were naturally developing who were recovering from COVID. So the idea that somehow this is a new discovery that natural immunity works is just not true. They've known this from the beginning. They've just chosen to hide this fact, I think, in order to try to get more vaccines into arms.
Well, you know, there's that old expression, never attribute to malfeasance, which can be explained by incompetence. Which is it here?
Well, that's one of the things that we would like to figure out is was there something nefarious here? As you say, the simplest explanation is obvious, is often the right explanation, and it could just be that it was more convenient. They were able to keep the message cleaner by saying that everyone needed to get the vaccine, but that had devastating consequences, as we discussed, and that doesn't really explain why the government went out of its way to censor people who esteemed doctors at places like Harvard and Stanford who were sticking their necks out and stepping forward to say, now, wait a minute, folks with natural immunity don't need this vaccine. And in fact, the cost benefit calculation might not be the same for everyone. It might be the case that a senior citizen is better off getting the vaccine. It might not be the case that a child is better off getting the vaccine.
You know, the classic case of that is this former New York Times reporter, Alex Berenson, who wrote routinely on Twitter about how natural immunity is effective. He went much farther than that, using studies to explain why he thought some of the vaccinations were potentially dangerous to some groups of people. I'm less certain about that sort of thing. But he was banned from Twitter. Now it's come to light that the White House pressured Twitter to ban him. Is that what you're trying to do in some of your lawsuits?
It is. We have joined a lawsuit. Alex Berenson sued Twitter and was able to get material through discovery in that lawsuit showing, just as you said, that the White House had directly pressured Twitter to remove him from that platform, even though Twitter had looked at him previously and decided that he was not in violation of any of its policies. Then after getting pressure from the White House, Twitter did remove him from their platform. we're representing some private plaintiffs in a lawsuit that the Attorney General of Missouri has brought on behalf of that state, Attorney General Schmidt, and the Attorney General of Louisiana, Attorney General Landry, has brought on behalf of that state against the federal government, against President Biden, against the Surgeon General and several other defendants who have been part of the decision-making process in censoring folks who have supposedly engaged in Twitter misinformation. But a lot of this so-called misinformation, the CDC is now admitting, is true, and it was true all along, and these folks should not have been censored or deplatformed.
I would suggest that there's probably an endless pool of litigants here, because if you just tally up the economic damage resulting from some of these policies, airline pilot shortage, teacher shortages, any kind of workforce issue, military, exactly. And they're also resulting in a lot of the supply chain issues that we've seen over the last several months.
There is an endless supply, as you say. For us as a nonprofit organization that's interested in effecting legal change with the cases that we bring, we tend to bring cases where we can force a change in government policy as a result of what we're doing. So you may see some lawsuits out there against some of these private companies. We haven't been bringing those. We bring our lawsuits against public entities, colleges, universities, the federal government, and so forth. But I do think that some of these entities that have been following CDC guidance better wake up, because now the CDC has changed its tune. It's no longer providing cover for folks who want to implement these mandates. Because remember, the CDC isn't the one who ordered a mandate. They just had the guidance suggesting that you should do it. It's the companies themselves that have imposed the mandate on their employees, or the universities, or the state and local employers who have done that.
And Mark, finally and quickly, if we know of somebody, or somebody's watching this program, who already had COVID, who had natural immunity and didn't get vaccinated as a result of that natural immunity, and they lost their jobs as a result of it, can they reach out to you, or do you have any direction for them, any advice for them?
Would love to hear from them. We are at nclalegal.org. That's our website. Folks can reach out to us there, or through phone or email. Can't promise that we're going to include anybody in future litigation, but we certainly want to hear from those people and find the right candidates for bringing additional litigation to bring an end to these unfortunate mandates.
Mark, it's really an important story. Please come back and update us on how these lawsuits are going, if you would.
Will do. Good to be with you. Thanks, Doug.